Hey guys, hello and welcome to my YouTube channel. As you have read in the title and the thumbnail, this video is exclusively for those people who have passed their USMLE Step 1 examination and now they are planning to start their CK preparation, but they have little idea regarding where to start the CK preparation, which resources to buy, what should be the overall strategy, what should be the time duration and all that stuff. So in this video, I am completely going to talk about all those points one by one. But first of all, a big congratulations to you for passing your step 1 examination. Now I would say that passing step 1 examination has two advantages. First of all, it sticks you to the journey, because before that there can be some distractions which can deviate you from the overall journey of the USMLE. But once you pass your step 1 examination, no matter whenever you give your step 2 CK examination, but the distractions are gonna be less and you will be more dedicated and more strict to your journey of the USMLE and getting the residency slot. So without further delay, let's start this video. See guys, when we had our step 1 preparation, we were absolutely clear with the resources. Okay, we had first aid in hand, we had pathoma in hand, and those were our primary resources. What we used to do, that we used to study from first aid, we used to study from pathoma, and after that we would switch over to the U world and solve the question, and the things were pretty smooth. But once you enter the CK arena, there are many resources. Okay, like the step 1, there are many resources in the step 2, like obviously the outdated one, Kaplan's, that is there. Online method is there. Some people will recommend you, there is a book called as Step Up to Medicine, that is there. Some will say, okay, Boards and Beyond also gives a subscription for step 2 CK, that is also there. Ambos is also there, UWorld is also there. So there are so many resources, but there is no clear description, there is no clear strategy. Everything look vague. Another thing, there is something called as master the boards, both for step 2 CK, for step 3. So guys, believe me, I was in the same shoes. I was in the same place like 10 months ago when I passed my step 1 and had to start my CK preparation. I had no idea like how to start the CK preparation, which resources to use and all that stuff. So what I did was, I got my step up to medicine, read it for like 15 to 20 days and saw that the things were not according to my expectations. Then I brought that master the boards, and after that I switched online method and all that stuff. So but there was nothing that was satisfying me, like that after reading that I was feeling happy, until I switched to the U world thing. uh, you will hear lot many people saying, okay, study U world, but because you have that idea, like first reading the theory and then going to the questions, so it becomes very difficult to do that transition. Like, okay, now you have only to do the questions without reading the theory. So that only point kind of terrifies. It used to terrify me, like how would I start doing the questions without having any idea of theory, like how would I approach the OBGYN, how would I approach the surgery when I have no idea. But I learned it the hard way, and that is what I don't want you to do it. So that is why I am making this video, and I am making it very clear that what should the resource be. Okay, so the resource for step 2 CK from the beginning should be UWorld. That's the end of the controversy. It should be UWorld. And now you would ask me, Speedy, how would we go and approach those questions of the UWorld? Now, since I have done like 85-90% of the UWorld, I am in a position to tell you how would you approach the questions. So guys, you know that in your step 1 you had the gastro thing. Okay, you had the gastrointestinal system. Believe me, if you have read that gastro, obviously you have passed the step 1, you know the gastro thing. You would go to the U world, let's say medicine, and you would make a block, same block like liver diseases, intestinal colorectal disorders, tumors and all that stuff. You would make a block, and believe me, by that step 1 knowledge, you will you will correct 50% of the questions. Okay, now rest 50% of the questions, I would say among those 30% are the newer concept. Okay, let's say screening is something that is new in the step 2 CK. Okay, then there are some algorithm, there are some treatment guidelines that are new in the step 2 CK. Step 1 was all about diagnosis, step 2 CK is all about doing the next best step. Okay, you know, so those are the knowledge gaps which you have to fill, and rest 25% are vague gray areas which you had the concept but were not able to apply or something like that. So that is the beauty, like you carry the knowledge from the step 1 about the diagnosis, because the diseases are the same. Let's say diverticulitis, it is the same, left lower quadrant pain, fever, leukocytosis. But here we have the management, like what if there is diverticular abscess, what if the age is like more than 70 or stuff like that. So that is the transition from step 1 to step 2, and believe me, it doesn't need more knowledge. You know the diagnosis already, now you wanna know the management option, and that is what the UWorld will teach you. So as a result of this, 50% of the questions are out of the sight, I would say, because you know them already. The focus has to be paid on those remaining 50% of the question. One, the knowledge gap, and other, the application part. So that is why I'm saying you that UWorld should be the only resource that you should be using. And I have also told you how to switch. Like you don't need to read any new theory. You just need to have that step 1 idea and just play on the front foot. Okay. Second thing you would ask me, Speedy, okay, how should I start the UWorld thing? Like whether I do it in a random mode, whether I do it in a system mode, whether I do it in a subject mode. How did I do it? Okay. So when I started doing the UWorld, I did it in a subject mode. For example, I would start medicine, and let's say medicine has about 1700-1800 questions, and I would start gastro, endo, repro, renal, those chapters that were in the same sequence like the first aid. You can start those chapters in the same sequence, and after you are done with one subject, let's say you are done with the gastro, you switch, let's say you are done with the medicine, you switch to pediatrics. Okay, so pediatrics is also the same. Okay, we have children, but the diseases are the same, like you studied in first aid. For example, there are some specific pediatric diseases. Let's say in the gastro we have biliary atresia, we have newborn jaundice, we have colidocal cyst. These diseases are specific to pediatric population, but the theory or the resources are almost the same, and by the same algorithm or by the same analogy, you will be able to do 50%, 60% of the questions in the pediatric blocks, and the rest 40% of the questions are where the newer concept come into the picture, and that you have to learn. After you are done with pediatrics, just shift to the surgery. Again, same concept. For example, in the step 1 you had those inguinal hernias already, you had pancreatic cancer, you had cholangitis, you had choledocholitis and stuff like that. So the same diagnosis are just moving into surgery, but the management option, the treatment options, those which have to be learned, and they have to be learned from UWorld alone. No need to go to this resource or that resource or something like that. Just stick to the UWorld. Now, medicine, pediatric, surgery, you are done. Now, I would recommend over here that while you are doing medicine, while you are doing pediatrics, while you are doing surgery, don't do the ethics question, don't do the communication question, because for that there is altogether different strategy. Right now I am focusing on the major chunk, like the major system. So medicine, pediatric, surgery is done. Now you are left with two subjects. One is the OBGYN and one is the psychiatry. Psychiatry is just the extension of step 1. Believe me, if you do the UWorld and then jump to the psychiatry, 60 to 70% of the questions are done. Rest 30% of the questions are all about management. Okay, when do you discharge this patient? How much the treatment, how long the treatment would be, and stuff like that. So psychiatry is also out of the picture. Now OBGYN, Yeah, OBGYN is the only subject which is, a little bit, I would say not that much of extension from the step 1, because reproductive stuff was not that much in the step 1. So OBGYN is something that has to be paid much attention. And believe me, there are like 600 to 700 questions of OBGYN that translates to approximately, if there are like 700 questions, then there would be like uh, 15 blocks, 15 into 40, okay, 600. So 15 plus blocks will be there. And what you have to do is like like first do obstetrics, then do gynecology. Okay, obstetrics you divide into 7 blocks, and then you would do a block daily, so it's manageable, like 40 questions a day. You just go through the block, see what you know, see where the gaps are, then you revise it over the whole day. So that is how you approach the obstetrics. So let's say there are 7 blocks, you will easily do those 7 blocks in 7 days. And gynecology, there are specific divisions, like menstrual disorder, breast disorder, tumors, and stuff like that. So you do those block one by one, like 40 questions daily, revise those 40 questions, switch to the next block. So that is how you approach the gynecology. So this was all about how you go to the U world, how do you start the U world, and how do you cover the U world. But again, I would try to bring your attention on one thing again, that don't jump between the resources, because this is the mistake that I did. It kind of it wasted my 2 months, and I don't want you to do the same exact mistake. So that is all I want to say in this video. Thank you so much for watching this video. For more videos like this, do subscribe to my YouTube channel.